Breast implants, what to know about rupture and contracture. Imagine you've just had a breast augmentation and are loving your new look. But over time, it's important to understand what complications might happen and how they can be managed. Two key issues are implant rupture and capsular contracture. Both affect the implant and surrounding tissue but are quite different in cause and treatment. A rupture happens when the outer shell of the implant tears or develops a hole. There are two main types of implants: saline and silicone. Saline implant ruptures are usually obvious because the saline solution leaks out quickly and the breast deflates visibly within days. Silicone implant ruptures can be more subtle because the thicker silicone gel inside tends to stay in place, so changes might happen gradually or even go unnoticed at first. Signs of rupture include pain or tenderness, which can happen if silicone leaks into nearby tissue and causes inflammation. You might notice the breast changing shape, feeling firmer or softer, or see lumps or nodules under the skin if silicone migrates outside the implant. Swelling or a hard, firm feeling in the breast can also be signs. Ruptures can happen due to trauma, damage during surgery, or simply as the implant ages. Silicone ruptures often requiring medical evaluation because the silicone gel is not absorbed by the body and may need removal. Capsular contracture is another common concern. After implant placement, your body naturally forms a fibrous scar tissue capsule around the implant to isolate it. Usually, this capsule is soft and helps keep the implant stable. But sometimes, this scar tissue tightens and hardens abnormally, squeezing the implant. This can cause the breast to feel firm or hard, sometimes like a solid ball under the skin. It can distort the shape, push the implant out of position, or cause discomfort ranging from mild to severe. In severe cases, the implant may become less mobile, and rippling might be visible. Capsular contracture affects about 5 to 17% of patients and often develops within the first 2 years after surgery, but it can also happen later. Sometimes, a rupture, especially silicone, can trigger this tightening because leaked silicone causes inflammation, which leads to scar tissue forming and tightening around the implant. If a rupture is suspected, imaging tests like MRI or ultrasound are recommended to check the implant's integrity, especially since silicone ruptures can be silent. Treatment for capsular contracture often involves surgery to remove the scar tissue, called a capsulectomy, and sometimes replacing the implant. If a rupture occurs, removing or replacing the implant is usually advised to prevent further issues. Staying in touch with your plastic surgeon and having regular follow-up appointments is key. They can monitor your implant's condition and recommend imaging if needed. Early detection and proper management help maintain the natural look and comfort of your breasts. Remember, each person's experience is unique, so personalized medical advice from a qualified professional is always the best course. Understanding these potential complications can help you make informed decisions about your breast augmentation journey and ongoing care.